One interesting case. It involved a young woman who was in her early 20s. She, like a lot of us, have pets at home. This one was a young dog that was very excitable. She was the light of this young woman's light, and somehow got a little close while she was feeding her, and the dog bit off part of her upper lip. Sometimes we can repair that just by closing it as a laceration. Other times we have to do some tissue rearranging, but this one was really a chunk of the red lip that involved the fullness right in the middle part of the mouth, the thing that we call the Cupid's bow. And without waxing too poetic, it's basically the thing that makes your kisser a kisser. Rather than thin the upper lip and create a very thin area, we decided we would try and replant this segment of lip. By replant, I mean we had to supply blood to the area. And as you might imagine, the upper lip has a blood supply that's about 0.5 millimeter to 0.2 of a millimeter in diameter. And that means you can barely see it with the naked eye. And so I got other members of our team mobilized, in particular, not only our stellar residents that we have on call 24 hours a day, 7 days a week, but my chief of reconstruction, Daniel Kwan, who's a very skilled microsurgeon. And the two of us took this young lady to the operating room, and it was in the middle of the night, and you have a limited amount of time to hook it up because the tissue starts to die as soon as it's separated from its blood supply. We took out the operating room microscope and we're zooming in probably about 40 times the natural magnification that you can see with your own eyes. You can actually see the blood vessels, and you can reattach them using sutures that are actually much finer than a human hair. That's blood flow into the area. Blood has to get out. But we couldn't find any veins that were even discernible, much less being able to hook them up again. And so we decided to use a technique called leaching. Just like if you go wading in a muddy pond and you get out of them, sometimes you have these little blood-sucking creatures that basically attach to you and suck out blood. Well, you can actually order leeches from a medical supply house down in South Carolina. What we decided to do was a technique known as chemical leaching, where we would take a very fine little needle and inject a little touch of heparin, which is a blood thinner, into this piece of tissue that literally is 1.5 centimeters at its biggest. Very gentle little taps of heparin into it, and it would ooze blood. Our residents actually parked themselves by this patient's bedside for the next 3 days and delicately pricked the flap, let it bleed until her own tissue reestablished hookups between blood flow in and blood flow out. You don't normally admit a lip laceration to the intensive care unit, but because of the amount of care that this took, she actually was in the hospital for a few days. But then it continued to heal and look just marvelous. So we saw her weeks, months after the fact. The last visit that we had, we took some pictures that were just spectacular. You could barely discern that there was anything wrong. The red lip lined up with itself, the white lip lined up with itself, and obviously she was very grateful, and we were just very pleased that we could participate in restoring her natural beauty. That's one of those cases that we get a chance to do on a not infrequent basis, where we're utilizing the limits of the technology that we have available to us and the skill set that we're trained to employ.